In this video, I'll teach you how to do an active labour position called the deep squat or deep supporting squat. This is a very important position to start to do in pregnancy to build up the strength and flexibility required to be able to hold a deep squat during labour. So you'll want to practice doing this a couple of times a day, building up the time that you can be in this position. The deep supported squat prepares your body for labour by opening up your pelvis. It increases your pelvic outlet space, making more room for your baby to descend during labour. It lengthens and strengthens your pelvic floor, which will help your pelvic floor to stretch more effectively during labour while also maintaining control. It encourages optimal fetal positioning, so the upright posture and the open hips helps and supports your baby moving into an ideal position for labour. It improves flexibility and endurance. It will help you to build strength in your legs, your hips and your lower back, which is very important for active birth positions. And it will help you relax and breathe. The deep supported squat will help you to practice staying calm and focused. It can be an intense position to be in at first, and the intense muscle sensations are similar to labour surges. You'll learn how to work with your body and breathe through these sensations. So you want to start with a wide stance. So stand with your feet slightly wider than hip width apart and turn your toes out slightly. This helps open up your hips. And then you want to lower into the squat. So slowly bend your knees and sink your hips down toward the floor. Keep your chest lifted and your back straight and bring your hands to prayer position. Press your elbows into the inside of your knees to help open your hips further and keep your palms together at the center of your chest. And then lengthen through the spine. So imagine your tailbone grounding down into the floor while the crown of your head lifts up. Now, if you aren't able to go down into a deep supported squat, there are some tools you can use to support you, especially during pregnancy or if you have limited flexibility. The first tool that you can use is a yoga block. So you can sit on one or two blocks placed under your sit bones to reduce pressure and strain. So you still get the hip opening benefit without needing to fully lower to the ground. Next, you can use a stool, a birthing stool, or a low bench. So these will give some good support and are great to use for longer holds or if you're preparing for labour. So if your heels lift off the ground, you can place a rolled blanket or towel behind your heels to support them. And you can also try using a wall for some extra support. So face away from a wall and lower into the squat with your back lightly supported. Now, make sure that you keep your heels grounded if possible, but use support if not. And only lower to a depth that feels safe and comfortable for you. Breathe deeply into your belly and of course stay relaxed. Now, avoid doing deep squats if you have pelvic instability and follow your medical provider's guidance during pregnancy as to whether this exercise is safe for you to do. So let's just practice one more time together. So, toes facing out, hands in a prayer position, and we're just going to lower, slowly breathing out into that deep squat. And we're going to use our elbows to push the sides of our knees out further, really opening up that pelvis, not hunching over, keeping that spine straight. And the longer you can relax in this position, the more opening you'll be getting in your pelvis. It's not particularly comfortable. I'm not used to being in this position. It is a pulling sensation. So if you can't go this low, or if you're fatiguing, put that stool under you and just continue to have that open pelvis effect with your legs out. You can also make it a little bit higher. You place that yoga block under there and work your way down into the type of depth that feels comfortable for you.